Hello, and welcome to our poster presentation, Stop the Squeaky Wheel, Improving Timeliness of EHR Optimization Implementations through the Use of a Lean Priority Matrix and System Governance. My name is CJ Wax, and I'm excited to share our experiences with you. Like many organizations, the demands for technological enhancements often exceed the technical resource availability. Also, like most organizations, the COVID-19 pandemic required extensive system changes to meet the ever-evolving developments in care. And while our IS department responded with urgency to these system changes, non-COVID system optimization requests languished. Meanwhile, the demands of the pandemic and concurrent staffing shortages took a toll on our care providers, and EHR dissatisfaction and frustration soared while engagement plummeted. The backlog of optimizations were perceived as contributing to inefficiencies and excessive demands to an already thinly stretched workforce. Optimization requests are also known as system enhancements or changes and often required to address clinical practice changes, improve usability, address deficiencies, and correct the many unintended consequences of EHRs, such as documentation burden and cognitive load. Since the implementation of its EHR in 2003, Beacon has grown exponentially, resulting in over 9,000 users, and every one of them has access to submit requests for system optimizations. Unfortunately, despite the years since its EHR installation, as of 2020, Beacon still lacked operational involvement in the assessment or management of the system optimization requests. This resulted in delays in EHR enhancements and contributed to end-user frustration, as the Informatics team tried to fill the operational leadership gap, which just meant requests were implemented on a first-come, first-served basis, but more frequently, the squeaky wheel model. You may better know this as the provider who yells the loudest wins. While the clinical backgrounds of informatics serve as well as liaisons for our bedside peers, the guidance and expertise of operational leadership is still required. Furthermore, greater objectivity in resource allocation and prioritization will ensure that optimizations result in the greatest value to the organization. Now, please excuse the liberty I've taken with the R of SBAR for this example. The resolutions we implemented to improve the management of our optimization requests included installation of a new EHR governing body known as the Clinical EHR Advisory Council, or CEAC. This multidisciplinary council reviews all new optimization requests for appropriateness and priority. A new optimization request website for improved clarity of requests submitted was also implemented. And last but not least, a number of analysis tools for prioritizing work when used together. These tools included the service level agreements, which with estimated design and build work efforts, an impact assessment tool, and an impact prioritization matrix. We'll be discussing these in greater length shortly. This is the Beacon-approved EHR Impact Assessment Tool. The user simply answers each of the 12 questions by entering a score in accordance with the provided criteria, and the impact score is automatically calculated. And here is Beacon's prioritization grid, or matrix. To use it, the estimated work effort is reviewed along the x-axis and the impact score along the y. Let's walk through an example. The Beacon Triage Work Group receives an optimization request to add 2 new orders to an established order set. The design effort for the new orders is estimated as 4 hours of work, while the build time is estimated as 2 hours, for a total of 6 hours to implement this change. The impact is assessed and calculated, resulting in a score of 55. Lastly, the priority is determined through the comparison of the effort versus the impact. So 6 hours of work, as you can see on the grid, is considered relatively low, while the impact score of 55 in this example is also considered low. As such, it shows as a 3, resulting in a priority group ranking of 3. There have been many lessons learned since the implementation of our optimization improvement effort in 2021. Some of those benefits include the CEAC partnership has definitely filled that leadership gap we were experiencing, as well as improved the transparency and reduced delays related to customer engagement challenges, such as failing to attend design sessions or responding to emails. The impact assessment and priority matrix tools mitigated ambiguity of prioritization and has decreased customer complaints, or those squeaky wheels. A provider has not yelled once since its implementation. And last but not least, these improvements ultimately resulted in a decrease in request backlog and an increase of 30% in optimization implementations. There were, however, some challenges experienced. The CEAC is still very much in its nascency, and as such, is still growing the skills and comfort related to negotiating the impact of individual requests in relation to the larger organizational need. The automatic cancellation of requests below the threshold is a challenging concept for the CEAC and has not yet been adopted. And the impact assessment tool, while certainly more objective than a yelling provider, it is still quite subjective and often resulting in variation of scores. And lastly, whenever possible, it is best to have operational owners complete the impact assessment to improve accuracy and adoption. This graphic represents the life cycle of a beacon optimization request. Please feel free to review this at length via the associated poster. Thank you for joining my session. If you have any questions or would like more information regarding our process or tools, please do not hesitate to reach out to me directly. Thank you and have a great day.